Okay, we're officially recording.
Great. Okay. Well, it's 2 o'clock. So without further ado, I would like to welcome everyone for joining us today for the CGD Association of America's Community and Coffee Zoom Talk with Colton Teicher, an adult bone marrow transplant patient who had a successful transplant recently, and also Rick Lofgren, the president of CODA, which stands for Children's Organ Transplant Association. And we're just so pleased to have you here because we often talk about the children's or even the infants' experience with a transplant for CGD, and we don't as often hear about the adult experience. And so this is really important. We have so many queries. I am often asked by our community about stem cell transplants for adults. And so I provide the resources that we have in terms of connecting our patient community with various centers of excellence that have done this, but there's nothing like talking to someone who's gone through it. And having gone through it myself, well, from, on behalf of my son who was 4, at any age, there are logistics one has to consider. We had to move from New York to North Carolina. We had Sebastian, my son's transplant at Duke. And Colton also needed to move from his home in Detroit to Bethesda, Maryland, where the NIH is based, and also expenses, even if insurance covers it, or in the NIH's case where it is provided, there are expenses to consider: lack of work, housing, travel, all of that can add up. And so the financial piece of it is also really important to consider. And then, of course, the transplant itself. What is it like to prepare for that? What is it like during the transplant? What is it like after? So all of those questions are so important. And I've tried to ask my 4-year-old son, but haven't gotten the answers that I think we're going to get today. And so they're really going to be helpful for us as we navigate our CGD journey for many of us who are still contemplating this, whether it's for their children, their loved ones, or themselves. So with all that said, before I introduce Colton and Rick Lofgren, I wanted to just have a little plug from Mark Dwanzik, one of our esteemed members of our CGD community. He's a CGD patient based in Silicon Valley, and we're very happy to have him with us. So I'm just going to turn it over to him, and then we'll introduce our panel discussion.
Hey everyone, hi, thanks Felicia. So I've met, it's good to see Ruben, and nice to meet Colton. Good to see some familiar faces. Nice to meet you again, Rick. So I just, some of you may know me already, but I'm a 60-year-old CGD patient. I'm remarkably healthy for 60 years old and having CGD. I was really pretty ill until my 30s and went through all the standard issues that young boys have with CGD. And now I actually have great problems of getting older and normal 60-year-old issues. So this is a small minor surgery I had recently, and it's nice to have regular issues. I have to be extra special attention to them because of my CGD, but it's nice to think about other issues besides only CGD. And I just want to, I met Felicia and this organization probably 2 or 3 years ago now, and it's just happy to give my support in any way I can. I want to encourage all of us to support this group financially as best we can. I think Amber can put a little donate link on the chat here, but just want to let you know, one is CGD does, when I was first diagnosed, CGD had just been recently changed from fatal to chronic, but still life expectancy was pretty in the 20s maybe, and now my doctors want to make sure I become a grandfather, so it's that's a lot different than something they call a fatal disease. So I know a lot of you can resonate with that, and it's just really it's Ruben and I were talking about, it's no cliche. We appreciate every single day we have. It's easy to say, but it's much easier to live and learn, live by. So it's really a pleasure to be here. Yet another remarkable day in my life that I get to be with folks like you. So Felicia, thanks for putting this on. Rick and Colton, thanks for being here to let everyone hear the good news.
Thank you so much, Mark. And with that said, the decision to make, what makes CGD unique, its decision is yours. You can live well with the disease, as Mark is a testament to, or you can seek other options, as Colton Teicher has done. So with all that said, we're going to give you the information that you need to navigate your journey. And I'm going to turn it over to Colton Teicher. And Colton, could you please introduce yourself? Tell us a little bit about yourself and your CGD journey and what led you to move forward with a transplant.
Yeah, so I'm Colton. I'm 24 years old. I had my transplant about a year and a half ago. And I'm from Detroit, and I had my transplant at the National Institutes of Health in Bethesda. And I had a lot of issues when I was young. And then maybe in middle school, things kind of chilled out a little bit. But then once I got into high school and then college, things started to pick back up. An interesting thing about my journey is that I was misdiagnosed for 20 years with various different diseases. And the doctors actually at the University of Michigan, where I usually go, refused to test me for CGD because they said it was too rare. And so for months and months and months, I was in and out of the hospital. This was probably over the course of 6 months. And they didn't want to do it. And finally, somebody agreed to do it. And shocker, came, turns out I had it. And I kind of decided to go through with transplant because I've always been, I love the outdoors. I've always been kind of adventurous. Right now, I'm doing a backpack trip through Europe. And I didn't want, I could see that things were escalating, and I wanted to be able to live my life as I wanted to, and didn't want to wait too long to go through with transplant, because, you know, as many people know, as you get older, the success rates aren't necessarily as good. So anyways, all those things together, I decided to go through with transplant pretty much as soon as possible. COVID obviously threw a wrench in that, but I was able to do it, and it was, in my opinion, it was a great choice.
Thank you for giving us your story, and I well, at least the beginning of it. We haven't heard all the different phases, and that's what we're going to get into. And what's really remarkable about you, Colton, is that you got in touch with me a while ago and said that you were going to, and forgive me if I'm not getting this exactly correct, but you were embarking on this kind of on your own. Would that be a fair statement?
Yeah, I mean, I didn't, you know, I was misdiagnosed for 20 years, so I had never met anyone who had CGD. And so I really, I was just like sending emails to just anyone I could, and I happened to stumble upon the CGD Association of America, and I sent you an email, and that's how we got in touch. But yeah, I kind of had to make things up as I went.
Right, and for many of us, we have family who go with us through the transplant experience. Younger adults or children have their parents, but from what I recall in our conversation, that you were really looking into this as something that you were going to do independently, which is incredible. And you were asking questions also about how to facilitate this financially. And so I can speak from personal experience that, you know, moving from New York to North Carolina for us, all the expenses involved, me not working, all those things were a challenge for my family. And so many of us can't imagine how we would just do this solo. So can you tell us a little bit more about how you did this logistically?
Well, I wouldn't necessarily say that I did it completely on my own. my dad helped me a lot through it, and he was there with me while I was in the hospital and during my 100 days post-transplant. So that was very helpful. But you know, you just do research, and I actually so I see the doctors at U of M, but I also went down to Cincinnati to the Children's Hospital of Cincinnati, CHOP in Philadelphia, and obviously the NIH, which is where I ultimately decided to have the procedure. And so, you know, I just asked as many questions as possible, got as much information as possible, and I guess just made the best educated choice that I could.
Thank you for explaining that. So yes, you did the research on your own.
Yeah.
You made the decision on your own, which is remarkable. And I'm so happy that your dad was there with you, and that you had that support, because it's so important. And so could you let us know what the preparation for your transplant was like, and what the experience of transplant itself was like, and then we'll get into what your post experience also was like. Let's start with the prep, and then the actual time when you were engrafting. If you could let us know how you felt during that time.
Yeah, so I'll start like a little bit before I even got to the hospital, because I think that's kind of an important part too. I have always been like a pretty anxious person, and so I was really making sure that I wasn't going to get sick. So I wasn't, you know, I was probably overly cautious, but I wanted to be as healthy as possible going into transplant. So I, you know, even though it was COVID, I wasn't doing much, and probably for a couple months leading up to transplant. And when you get there, you know, things kind of move fast, and you're doing a lot of testing. So like CT scans, blood tests, pulmonary function tests, to make sure that you are healthy enough to go through transplant. And then the prep prior to transplant, so like I believe, so there's negative days, day 0, which is transplant day, and then positive days. So the negative days start with you know, the chemo and the radiation, and sometimes other drugs, like monoclonal antibodies and stuff, which is what I had. And it can be pretty rough. I will say that one thing everybody talks about how chemo makes you really sick, you know, nausea, throwing up, just generally not feeling well, but it was more painful than I was expecting. And everyone at the NIH did tell me about that, but I would say just like people in general who go through like cancer patients and such kind of don't talk about the pain as much. So that's one thing that I would put out there, is just a warning. Right.
And having been at my son's side, I watched him as he went through what was incredible pain, and the nausea and throwing up, and that was really difficult. No one should sugarcoat the transplant experience.
Yeah.
Leading up to what is day 1. And so those are the 2 weeks prior to the actual transplant. And many people don't realize that the actual transplant itself is kind of a non-event, right? Can you tell us about the actual transplant itself? It's like transplant day.
Yeah, it's pretty boring. It's literally just a cell infusion through IV. It does take a couple hours, and it depends on how many bags of cells that you have. I can't remember how many I had, maybe like 6. But yeah, I mean, there is a protocol that the nurses follow, so that's pretty strict. And I think, if I'm not mistaken, that there's always a nurse in there monitoring you, and they're really helpful with getting anything that you need. Zofran was a huge help for me, and I know it doesn't work for everyone, which is unfortunate, but it works really well for me, and I know there's alternatives, but it might one thing that might be helpful is to know what works for you before you go into transplant. Because I knew that Zofran worked for me, but anyways, yeah. The only other thing is that the preservative that they use to keep the cells good kind of smells bad. So you're going to smell for maybe a couple days during and post transplant. But yeah, overall, it's pretty boring.
Yeah, and you had an unrelated bone marrow donor, correct?
Yeah.
Right. So many of our patients have sibling donors that match, but if you don't have a sibling donor that match, there are registries that you can look into to find a match. In our case, no one matched our son, and we used an umbilical cord unrelated donor. And we are getting questions. So I'm going to ask Amberlynn, who works with us, to read some of the questions. And what we're going to do towards the end of this chat around 2:45, we're going to open it up to everyone. But in the meantime, let's read some of the questions that are coming through. And then if you could read those, Amberlynn, then Colton or Rick could answer those as well while we're chatting.
Yeah. Hi. So we have the first question, and this is coming from Ruben and Sherry. They ask if you were able to use anything for the pain or even something like cannabis. I know you already mentioned Zofran, but any other pain relief that you found comforting during that time? And he appreciates the details that you mentioned. And he says usually it's patient groups where you can get these kind of entities. Did I say that right? So that's the first question so far. And I'm also going to send a direct PayPal link for those interested in donating. Okay.
Yeah. So the doctors and nurses at the NIH were fantastic with the pain management aspect of it. The two main drugs that I used were Dilaudid and morphine. And I did have to use, I can't remember the technical name for it, but one of those pumps that you use for pain. And usually it's around like 15-minute intervals that you can press the button when you have pain. But yeah, the drugs definitely did help the pain. So that's great. So, just make sure you're talking with your doctors about that. As far as cannabis, I didn't use any while I was in the hospital. I mean, I do sometimes use some recreationally, but as far as pain, I've never found that it really helps with pain. That's just my personal experience. I know that other people, it can help with pain. And certainly you don't want to be smoking. But I think that edibles could possibly be, as long as you talk to your doctors and the hospital allows it, that is something that might be of use.
Yes, and there are certain modalities too that are complementary. And what I did, according to some research actually from Memorial Sloan Kettering Cancer Center, to help with the healing process and pain and nausea is to work with your doctors. I showed our transplant team all of the products we're using, but essential oils. So mint for nausea and lavender for calming. And I would use those to massage Sebastian or just do infusions, in the room. So the room would smell like various things based on what he was going through. So those are some other ideas for you. Okay. Now, as far as the transplant, we talked about transplant day. How long did it take you to engraft, which means that means you have a certain level of cells that are the donor cells. Usually that's about 2 weeks, and between transplant day and the 2 weeks, that's the most critical time, when you're vulnerable. So can you tell us a little bit what that was like, how long it took you to engraft and feel like maybe, you were turning the corner at that point? I mean, there's still complications that can happen after engraftment day for sure, but can you walk us through that as well, Colton?
Yeah, I believe I engrafted on day 17 post-transplant, which is really, the NIH was really good with, on this day, this is going to happen, and on this day, this is going to happen. So that was kind of cool. They told, they said on average, people usually engraft around day 17, if I'm not mistaken. But Yeah, I mean, it's a bit nerve-wracking because, you know, if not engrafting is very scary. But yeah, I engrafted on day 17. And also another thing to keep in mind while you're, you know, because they're going to come in and tell you all your counts, your neutrophils, your lymphocytes, and all those things. It's not going to be linear. It's an up and down, up and down. So, you know, don't be scared if, you know, one day your cells are here and the next day they're here, because that's normal.
Right. And then that's the way they described it to us. They
Yeah.
said, transplant team said it's a roller coaster. And if
Yeah.
anyone likes coasters, we just went to Universal a couple weeks ago with the kids. I've started to like them now. I think it's from my transplant experience. That's very much what it's like. So yeah, very, very good way to describe it. And so Colton, when did you start feeling better, and when were you finally discharged, and what was the experience after you were discharged from the NIH?
So I think I started to feel better around maybe 1 month, like maybe 30 days post-transplant. And honestly, I can't remember the exact number that I was discharged from the hospital, but it was shortly after I was feeling better. And they really, you know, it's better to heal when you're outside of the hospital. So they're really kind of good about like wanting to get you out into the apartment and you know, being able to do more things that you want to do, not getting woken up every night. So yeah, I would say, you know, about maybe 25 to 35 days post-transplant.
And so you then discharged and you lived in an apartment near or on the campus of the NIH. And then in our case, we need to go back every day to the clinic for monitoring for more infusions. So how long was your experience going back to the clinic each day? And when were you finally able to move back to your home in Michigan?
So at first, so there's a few viruses, CMV, cytomegalovirus, Epstein-Barr virus, and I think there might be a couple more that lay dormant. So if you get infected with them, usually when you're young, they lay dormant in your system and normally wouldn't cause you any problems. Except if you go through transplant, they can get reactivated, which my CMV did. And nowadays it's not a big deal. They have really good medications to take care of it, but it affects your levels, certain levels a lot. I don't remember exactly what it was, but I was having to go back every single day for a while. And then it was like every couple of days and then once a week. And I don't know that I ever got to like less than once a week. But I was allowed to go back home around day 90 post-transplant. Yeah.
That's great.
Back to Detroit. Yep.
Yeah, and that's generally in line with the average, I think. You know, these like 3 months post-transplant is when patients can begin considering going back. In our case, we stayed longer in North Carolina. Sebastian had some complications, but yes, that's sort of the rule of thumb. And I think we're getting to about the time also that I wanted to talk about the big question in the room, the thing no one likes to talk about, which is money. So we all know that there are expenses involved with transplant, no matter what, whether insurance covers it or whether you get your transplant, the NIH, which is fully covered thanks to funding from the federal government. But not everything is covered. And so we want to talk a little bit about how you manage that, and then turn it over to Rick Lofgren, who is the president of CODA, which stands for Children Organs Transplant Association. And we actually worked with him because we had a fundraiser, and it helped us out a lot to ease some of those concerns. And so if anyone is thinking about how they're going to raise funds and deal with some of the extra expenses and the major ones involved, I do think it's important to think about ways that you can support yourself by reaching out to friends and family. And CODA provides the platform to do that. And so, Colton, I was wondering if you could tell us a little bit about working with CODA, how you came to do that, and then we'll turn it over to Rick to talk about how his organization works.
Yeah, let me just turn this light on real quick. It's getting a little dark.
What happened there? Was there like an eclipse or? Thank you.
Yeah.
And Colton is hailing today from Italy. So this is really
Yes.
into life after transplant. He's backpacking through Europe. He's joining us today from Italy. So it's a different time of day there. And so, hooray. Yeah, we see people clapping. Ruben's clapping for you. We're all, just so happy to hear that you are doing something so cool. So just wanted to put that there. Now, if you can tell us a little bit about how you can work with CODA, what the experience was like, and yes, we'll turn it over to Rick, who can explain a little bit more about his organization and how it works.
Yeah. Honestly, I was blown away. That just they answer all the questions you need. They're available. I mean, Rick personally did a Zoom call with me to answer any questions that I had. They have a lot of different departments where, you're going to submit expenses or just really, really good at answering questions and helping in any way they can. But essentially the way it works is you create a team. And usually it consists of friends and family, and then they run a campaign for you and raise money, and it goes into an account, and then you're allowed to use that money that was raised for your transplant related expenses. And it's just really helpful to have that money there and not have to think about the money when you're going into transplant. I never had to worry about it. I'm very thankful my team raised $50,000 for me. And I was also really lucky to have some really good friends who worked hard on it, and so that was great. But yeah, so basically what you do is you get a transplant related expense. And that can range from an actual bill from your transplant, medical bill, or food at the hospital, or transportation to or from the hospital. And essentially all you have to do is just take a picture of the receipt or a screenshot, submit it to their website. And then, they review it, and in a couple of days, the money is in your direct deposit in your bank account.
Exactly. Yep. That was our experience too. And so we were really grateful to Rick Lofgren and all our friends at CODA. And they also have a blogging feature, which we used every day. And Miguel, my husband, turned into a book, that was published by Penguin a couple of years ago. So it was really quite the win-win for all of us. So with all that said, Rick, I'm going to turn it over to you. And if you could tell us a little bit about your organization and how it helps CGD patients going through transplant, we'd appreciate it.
All right. Well, thank you, Felicia. I want to thank you all for taking time to connect today. I've been with CODA for going on 25 years. And the thing that I like most about what we do is that we actually get to meet our families. Colton said we did a Zoom call, which we did. And I've done a Zoom call also with his brother, Caden. Done that with many of our families over the past 3 years during the pandemic, because we're an organization that feels that it's very important for us to connect on a one-to-one basis. And so it is not simply much like you experience when you go into the hospital and some medical professional walks in, and before they even say hello, they ask you what's your date of birth and your social security number, and you do feel a lot like a number. My hope is that you never feel like a number when you're working with CODA, and you feel like the human being that you are. And that's the way I want to be treated, and we hope that we treat all of our families that way as well. I do want to comment, and Colton, I got to give you props for this, not only for the fact that you're in Italy right now, as Felicia said, living your best life, You said earlier, I want to live my life, and you made that conscious decision. And that's where we want to work with families. It's not just what do you need to do to get to the point of transplant and perhaps home again. It's what do you want to do after that? What are those things that you've had as hopes and aspirations that you just couldn't do? And now your new lease on life following your transplant gives you that opportunity to do that. And so we look at this as we're helping families for a lifetime of support, and not simply what do you need to get to transplant and back home again. We want to have those conversations. And I hope, Colton, you and I will be having this conversation another 24 years. But I want to be able to see our kids and our young adults grow up. I want to be able to say these guys have gotten married, gone to college and graduated, all the things that you want to do, but you thought perhaps might not be possible. And I'll tell you, after talking to Mark the other day, I'm just blown away by how well he's doing. I think, Mark, you shared a lot of detail that I won't say because it's your story, but I do think when you were first diagnosed, I think you probably thought teenager was about as far as you might go, and here you are. So I wish you well getting to be a grandfather. That will be a fun experience for you.
Thanks, Rick. Very kind of you. Thank you.
Well, what we do is, and Colton hit on this and Felicia did as well, we raise money to help with those costs that you have. So it's everything from the co-payments and deductibles that are obvious. It's the medications and prescriptions that you'll have. It's the transportation and lodging. I think you've all heard going from New York City to Durham, North Carolina, or going from Detroit to Bethesda. It's not like you're going to the hospital that you get your primary care taken care of that's 15 minutes or 30 minutes away. It's an extended period of time we're away from home. And most of our families, when they do that, not only do they have those new costs at the transplant center, but they also still have their other expenses back home. So it's maintaining two households. It's perhaps having a spouse or a parent in one place and the other spouse, the other parent, the other place. So you're at the time that your income probably is decreasing, your expenses are dramatically increasing. So what we want to do is come alongside our families to help with those expenses, those long-term costs. We want to ensure that you have a home to come home to after the transplant takes place. But again, we want to make that transition to transplant and back home again as seamless as possible. So how we do that, and Colton described this very briefly, and I also want to say Colton generously has offered and been the lead fundraiser for his brother's campaign at CODA as well. He's done a great job, raised more than $25,000 there as well. So he's got good experience both as the patient and also the lead volunteer. So Colton, you're probably going to get lots of questions about that afterwards. But we don't want you, when you're going through the transplant, to focus on fundraising. We want your family, your extended family and team and volunteers to work with that. So we will, and I say this kindly, but we try to stiff arm our patients to focus on their health and getting back to full health and strength. And then we'll work with the volunteer team. We'll train them on how to do fundraising events, because we're a 501c3, much like a hospital. Gifts that come to CODA are tax deductible for the donor, but the benefits that you receive as a patient are not taxable because we're that 501c3 charity. So anyone that has Medicare or Medicaid funding that does not disqualify you or cause you to pay a premium on that coverage, there's no 1099s that are involved in this. It is just simply you submit the receipts, as Colton said, on the website, and then we push the money right back out into your bank account. Or if we're paying someone else, we'll pay them that way as well. But we want to make this as easy of a process for you so that you, again, can focus on getting back to full health. Now, typically the people that we work with most closely are transplant professionals within the transplant center. I mentioned to Felicia, I was in Durham not long ago, and I was not able to meet with that team. And what we found is over the past 3 years, and this is for all of us, not just at CODA, our lives were turned upside down, and we figured out how to work without doing the things that we used to do the way we used to do them. So we found support groups. Doing events like this really makes sense because word of mouth of someone who's had a successful experience is a whole lot better than even having a transplant professional tell you this is something you ought to consider. So what we want to be able to do is to share that information with you, and our information that you saw that Felicia shared, that information is the best way to get a hold of us, either visiting our website, that's cota.org, or you can call our 800 number, that is 366-2682, and I promise I'll repeat that later. But if you reach out to us, we'll walk you through the process. You can get on our website, take a look at it, poke around. You can talk to people that have been there and done that. Colton and Felicia have obviously had the experience and understand how that works and how that worked well for their family. There are also other organizations that do this, and we want to make sure that you know that CODA is not the only person or the only organization that does it. If it were my wife and I, we'd sit down at the kitchen table and we'd make the decision that made the best outcomes for our family. We want you to do the exact same thing. I'm selfishly believing that CODA does it better than anyone else does, but we also want you to take a look and make sure that you feel the same. So what we'll do is we'll walk you through the process. We'll send you some information. We have videos of what other families have done and share their information. We'll work with referral sources. So if you have someone that you'd like to talk to, like Colton or Felicia, we'll let you make that connection and have those offline conversations. But the bottom line is we want to make sure, again, you have that opportunity to live your life, as Colton mentioned, and you get to go back home and continue to do the things that you'd like to do. I can go into very specific things about fundraising that I don't know that you want to do that today, but I would be happy to answer questions that you have about how we help, how we do fundraising, how we can work with your family. The online submission portal that Colton mentioned is something that we're actually updating, and hopefully it will be even easier to use in the future. But it's something that we found it makes a whole lot of sense. And I don't know about you, but I don't go into banks anymore. I do all my banking online. You can do the exact same thing with submitting receipts and get reimbursed with CODA.
Thank you so much for walking us through that. And a couple of things came to mind through my experience working with CODA, and that is, yes, it was such a relief not to have to spearhead this myself. As you said, you strong arm patients, because as a CGD mom, I'm used to just carrying the world on my shoulders and doing everything myself. A lot of CGD patients are used to, when they're adults, used to doing everything themselves, as Colton did all his research himself and, embarked on this beginning, on his own. And so we're just used to, taking care of things and not relying so much on others. And it was such a relief to me that is one of the core competencies of CODA, that you encourage us to entrust this process to one of our close friends or family members. In my case, a close friend did it, and she just ran with it with flying colors. And I was so grateful to her and grateful to you. You never know in this kind of situation who's going to step up. And this is another thing that just gives you faith in humanity, because I had no idea that she would do this for me, and she did with such commitment. And so I will always just be grateful to her and to you for that. And the other piece of it is the competition, or the other ways that one can go about fundraising. Certainly, many in our community use GoFundMe, for example. That's an option, but the difference is, of course, is GoFundMe is not a Section 501c3 like CODA. So donors do not get a tax deduction when they donate to someone raising funds this way, whereas with CODA they do. So you might find that you get bigger donations when you fundraise via CODA, because everyone who donates will get a tax deduction for that, which makes CODA unique, I believe. And so we saw that in our case, where we were able to raise, I think, more than we would have, otherwise. So many things to consider when you're looking into this transplant journey from that perspective. And in terms of questions, we're at that point where we do have some questions, and it would be great to hear from our audience. And so why don't we toggle over to those who had questions, put them through the chat. I think I saw one come through again from Ruben, and I'd love to introduce Ruben to our group anyway, because he's one of our fantastic members of the CGD community. He is an adult patient with CGD. He runs a very successful business. He has held webinars, helped us produce webinars, and he just does all kinds of really wonderful and cool things. So Ruben, I know that you had some questions for Colton and perhaps for Rick as well. So I'll turn it over to you, Ruben, and you could ask yourself.
Oh, thank you so much. Can you all hear me okay? Okay, perfect. First, I wanted to thank you so much, Colton. I really appreciated you sharing your experience. And it really touches me, hits me in the chest when every time I hear about someone who's been cured. I'm just so encouraged. I know I'm in a text thread with a lot of younger folks who are your age and younger, and one of them just went through the process, and I was like, wow, I can't believe it. I can't believe it. So I recently started thinking about it for myself. I'm 48, so I'm significantly older, but I never, in my 30s and early 40s, I never thought I was a candidate. I started looking into it a little bit more, and I never thought I never thought I'd live to 40. So that in the first place, I never thought I could possibly be a candidate for BMT. I don't necessarily think that I am, just because my baseline has gone down at the age that I'm at. But I'm really encouraged for folks your age and younger, and you get to live an entire life that I could really only dream of. And I'm just really happy to see it. I think it's really, really amazing. Rick, I was going to ask you, is there like an age cutoff for a patient age cutoff to work with you all? Because I thought I heard in the name children, so I'm just assuming, kind of like Children's Hospital. I'm kind of assuming it's for folks like there's got to be an age cutoff, or maybe I'm misunderstanding the acronym or what have you. And also, nice to meet you as well. I should have said that before.
Thank you.
It was great to meet you. I really appreciated the information you shared as well, and that your organization is doing the work that it's doing.
Well, thank you. And Ruben, even at 48, you're still a young man. Your best days are ahead of you. Well,
Thank you.
There is an age cutoff, but it is for patients that don't have a single gene disease like CGG. So we work with patients of any age up to 21 who have a need for bone marrow, cord blood stem cell transplant, or any solid organ transplant. And for those with a single gene disease, there's no age restrictions. And we have a board member who has cystic fibrosis, which is another one of the diagnoses that qualifies, that persuasively argued with her fellow board members that this is a disease that she was diagnosed with as a young child. And she just was healthy enough, thanks to medical technology, that she didn't need the transplant before she turned 21. So she did a very good job, persuaded her fellow board members to make that exception. And so that's the carve out for our 21 and younger. So we can help everybody that's on this call. We can help you regardless of what your age is, whether it's 24 like Colton or 48 like you, Ruben.
Thank you so much. I really appreciate that. I guess I should look further into figuring out, whether I'd actually a candidate or not. After the last CGDAA call, I strongly suspect I'm not a candidate, but maybe I guess I should pursue it a little bit more deeply to get some certainty in there. What is the best I didn't mean to cut you off. Sherry just asked me a question. She's on the other side of the camera. Her workstation's over there, but she just asked me to ask y'all if you could give us some recommendation. What is the best way to definitively find out if you are a candidate for a BMT?
I'm going to say that don't discount it, because you never know. But the number one thing I would say is try to get in contact with the NIH if you haven't already, because they have a very good record of accepting patients who may not be accepted in other places, and having successful outcomes with that. So yes, definitely the NIH, and I'll do a shameless plug for them till the end of time, because they're absolutely amazing. So yeah, that's what I would recommend.
Thank you very much, Colton. I really appreciate it.
Mm-hmm.
I would second that. Just in terms of whether you decide to go through transplant or not, if you haven't been to the NIH, I would recommend going there and having a meeting with the CGD team, and they will do some testing of you, some diagnostic testing. You'll learn a lot more about how you're doing, what your actual baseline is from their perspective, from the experts, the world's leading experts. And they're just wonderful, and it's free. So it's a nice trip to, the DC area. So you can complement that with maybe a trip to looking at monuments or something. But anyways, we always enjoyed our time there. The first time I was there was a little bit imposing because you have to go through kind of an airport security kind of, right, Colton? It was a little bit like unnerving to go through, but once we were inside, we just felt we were welcomed with open arms and just very comfortable. They're really kind people. So, and so educated. So well-versed in CGD, which is such a refreshing thing because we're used to going to places where people are like, what's that? What do you have? I've never heard of that before. So to meet people who are so well versed in our condition and so confident is just a blessing. Are there any other questions that we have from the audience?
Yeah, so Felicia, I'm seeing one for from Eileen. This is directed to you, Colton, which, by the way, hello, and so nice to meet you, and thank you so much for speaking. So she's asking you if you had any particular medication that you took, like antibiotics or antifungal, and if so, how long were you taking that after the bone marrow transplant?
Yeah, so usually, you're on a pretty intense regimen of medications during and post-transplant. But again, they have kind of like it's not a one set fits all, but generally they have a timeline of when you can start to gradually go off medications. And so I was on blood thinners for 10 years because I had deep vein thrombosis, clots in my legs, I had clots in my brain. And so I was on that for a year post-transplant, and I've been off for like 7 months now, which is awesome because I was injecting myself twice a day. It really sucked, but luckily, now that I'm cured, I don't have to take those anymore. But as far as other transplant medications, you'll have to take medications for 2 years post-transplant. They do gradually decrease as you get further out. So usually you have to take an antibiotic, which I'm taking Bactrim, and also an antiviral, which is acyclovir for me. So I only have, I think, like 5 more months on those, and then no medications for the rest of my life.
Wonderful. Wonderful. Yep. Are there any other questions from our audience that you'd like to ask Colton directly?
I would.
Hi,
Let's hear-
Crystal. Crystal's another
Hi.
wonderful member of our CGD community.
Hello.
Introduce you. She is hailing from Los Angeles. She has a gorgeous toddler son named Cyrus, who was diagnosed with CGD, and they're contemplating transplant as well. So I'm very happy to introduce Crystal to you, Colton, and I think you've met before. So yes, take it away with your question, Crystal, please.
Hi to all the familiar faces. Hi to the new ones. I am actually in talks with Dr. Malik, and I wanted to know who were the people that you worked mainly with in your transplant, and also who were there other CGD patients there while you were there?
Yeah, so my main doctor was actually Dr. Kang, but I did see Dr. Malik quite a few times. They're like the best doctors I've ever had. So yes, those two are great. Elizabeth Quirk is on this call as well. I've had fantastic experience with Elizabeth. She's a nurse practitioner who works at the NIH. And then the other main contact, she no longer works there, and I'm not quite sure who the person who replaced her is. So that I don't know. And were there other patients there? Yes, there were a couple. I met 2 guys. The first person I ever met besides my brother who had CGD, I met like the second day I was there, which was great. And I do occasionally still keep in touch with them. They both also had successful transplants, and honestly, they're probably pushing 2.5 maybe years post-transplant. I'm not exactly sure, but yeah, as far as I know, they're both doing great.
So these were older patients that you were able to keep in touch with.
Well, they had just, so the first guy that I met, his last day was essentially my first day there. So he was already 100 days post-transplant. So I guess it wouldn't be quite 2.5 years, but yeah, they were in their early 30s, mid 30s.
wow.
Yeah.
Wow. My son is 3, so I'm very, aside from Mark and I think only Mark, I don't know any patients or have heard of any patients really in their, well, actually through CGDA I've seen a few, but I've never met any that are in their 20s and or spoken to very many, so let alone 30s, and Mark is a unicorn. So now Ruben, right? And so I'm always fascinated to hear these stories and successful cases. But if possible, I'd love to have your contact information so I could just talk to you more about it, because I have so many questions.
Yeah,
If you don't mind.
absolutely. Yeah, I'd be happy to give my number to, if you want it right now, I'm always happy to answer
Sure.
questions.
Can you post it in the chat,
Oh yeah,
please?
I'll text it in the chat. Yeah.
Thank you.
Oh, I'm so happy. This is what we do at the CGDAA. We connect people because I know what it was like to feel alone. And it was only through connections that I was able to navigate the path forward for our family. So this makes me so happy. And if I may, I think we have someone here on the call. Well, first of all, I wanted to ask if there are any more questions, because I was going to introduce someone else who has an adult son who went through transplant, but Ruben has another question. So let's go to Ruben.
Thank you so much. I'll keep it really brief. So Sherry had a question. If I did indeed get the transplant and do the procedure, during that point of time where they basically bring your immune system all the way low, does anyone have any idea if I'm going to be isolated, like if Sherry would be able to have any contact with me, or if she'd have to live in another location? Are you in like a hospital room that's like a clean room? Does anyone have any familiarity they could share anything about that?
I think it depends on where you're having it done. Sorry, I'm late. I read 2 o'clock and I'm Central Time, so I'm a little late. Because at NIH, my son had his, he just turned 33, so he had it at 32. And I actually stayed in his room with him for the first 13 days that he was inpatient. And then I could come and go as I needed.
Thank you so much. I really appreciate that. Nice to meet you as well.
Yes, that's Kathy. Meet Ruben. Kathy, and she's the one I was going to introduce. How perfect is this? She answered your question. I mean, this is like destiny. So, and I think I'm guessing this, your son, Kathy, might be the one that Colton met. It sounds like that could have been there. There could have been an interaction.
Colton sounds very familiar, so I'm sure it is. Colton, how old are you?
I'm 24.
Okay. So
What's
yeah,
your son's name?
huh?
What's your son's name?
Nicholas
Oh,
Narlock.
yeah. I think
Yeah.
I've met Nicholas. Yeah.
Yeah, we've been going to NIH since about 2000 and maybe 2002.
Yeah.
So yes, Colton sounds very familiar. So I'm sure he's met you or I've met you, and glad to hear you had the treatment and you're doing well.
Yep.
And how is Nicholas doing?
He goes back in May for his 1-year checkup, and he has been doing wonderfully.
Yes. Yeah, I think I knew that, but I wanted to hear you say that because I've been following his progress as well, as I always do with our community. I'm always watching you guys, don't think I'm not. So, and praying for you guys as well, so I am just so grateful as we kind of have the last 5 minutes of our call. I want to make sure we get all of our questions in. Are there any other questions that anyone in our audience would like to ask directly to either Colton, Rick? Now, we have others who can talk about their experience going through transplant with adult sons. So Kathy can also speak to our son's experience. So do we have any other remaining questions for these minutes?
Hey, Crystal, it's Mark. Someone calling, being called a unicorn in Silicon Valley where I am is so passe now. So I'm looking forward to making a lot more unicorns in this group. How's that?
I like that.
It's very passe here.
Yes, yeah. So I actually do know other patient CGD who are in their 60s and even 70s. And so it is possible. And, as I said, there are many ways to navigate CGD. And so we're just here to provide as much information and education as we can so that each person, each family can determine what's the best path for themselves. And I think in the last few minutes, what we might want to do is talk a little bit about what Rick can do for the community in terms of some other things. Like he said that he's a lifelong partner, and I'm a testament to that because they keep up with me. Sebastian was just featured in a calendar that they had. And if you could tell us a little bit about, I guess, the ethos of CODA and what drives you, Rick, to really see yourself as a lifelong partner. And we'll end on this happy note because we see ourselves the same way, the CGD Association, and that's why you're one of our really wonderful partners here. So I thought that would be a great way to close out our call.
Well, thank you. And I really do feel that way. I joke about this, but my dad was a pastor as I was growing up. And at the end of every service, he'd stand at the back of the church and shake people's hands as they walked out. And that was just something that was ingrained on me from a very young age. And that's kind of how I feel like we operate as an organization. It is not that give me your social security number before I can say anything. It is, we're here to help and we want to be your partner for life. I look at this as we feel like this is the next step in your life and your next journey. And I don't want this to be a let's get this done and move on to the next thing kind of relationship. It really is, it's a lifetime of support. And we want to make sure that your families know that. And it really is a family case in all of our family situations. It's not simply the patient or their caregiver. I love what I've heard from the questions. I love the fact that Ruben, you're having a conversation. Your wife's on the other side of the screen asking questions as well. It really does take a team to do this. It's not just a one-person show. So we want to be part of that and to help you along the way.
Thank you. And one other final note in the last 3 minutes, Colton, I want to know about what you're doing in Europe. Can you close us out with where you're going, what you're seeing, and give us some inspiration so that we can travel in your footsteps?
Yeah. So I arrived in Paris on April 11th, and I don't come home until May 16th. And I am doing it by myself. Just kind of going with the flow. I'm going to spend about 2 weeks in Italy. And then after that, I'm winging it. I don't have any plans. So quite excited, a little bit nervous, but having a blast.
And what's
playing the puddles over there?
Yeah.
Going in fresh water, because I am so jealous of the simple things like that.
That's so funny. Yeah, I definitely will be rolling around in mud and
get dirty for me, because somebody's got to. Someone's got to get some mud and some fresh water on them.
Yep.
Nick wants to do a mud run the week before he goes back to Maryland for his 1-year checkup, and I keep saying, please just wait. Please just wait.
I love it. It's the simple things.
Yeah, and Colton, if you ever want to share some photos of you like doing something like at the Eiffel Tower, or I don't know, at the Leaning Tower of Pisa, we'd be happy to share them as inspiration for the CGD Association. We're so inspired by you, and I can't tell you enough how much it has meant to me to meet you, and that you're here with us today, and all of you who are on this call, you know how I feel. I talk with you all many times, whether it's a Zoom call or not. I'm always here, and I'm always thinking about everyone in the CGD community and being able to create opportunities like this for us to get together and have these real conversations. They're so important. So, with that said, I think we're at a point right now where we're coming to the end of our call. It sounds like Colton is available. I think he put his, and that's not just sounds like, he is available, he put his phone number. Thank you so much, Colton, in the chat. So I hope everyone took that. If not, please feel free to contact me, and I'm happy to put you guys in touch. Rick also put his contact information there. If you need anything else, I'm happy to put you guys in touch. Kathy, if you would like to be available for any questions, you can let me know offline, and we can, facilitate any kind of connections as well. And Ruben, of course, Ruben, I just know that you're there. If anyone needs anything, from, web advice to like how to have a great marriage, he and Sherry are an inspiration to us all. So how to live well with CGD, all of these things, Ruben is here. So this is just a testament to the wonderful community that is the CGD community. And I feel so blessed to be a part of it. You know how to reach us afterwards. We appreciate any kind of feedback that you have for this meeting and your donations as well. So thank you all for participating, and I look forward to being in touch. There's more exciting news to come, so stay tuned, guys. Please read our email newsletter, come to our website, and I'll be sharing some more exciting news for you in the future. So thank you all.
Thank you, Felicia. Thanks, Rick.
Thank
Thanks,
you.
Colton. Good to see
Yeah,
you,
please
Ruben.
please feel free to reach out. Seriously, if you need to, you can text me, whatever.
Yes, and I'll be sending everyone a quick info email about all the information that was shared through the chat, the recording of the chat. So stay tuned for that.
Thank you, Amberlyn.
Thanks,
Thank you.
Evelyn. Thanks, everyone. It was so
Thank
good to see you all.
Yes,
Thank
thanks.
you.